Next, ladies and gentlemen, we have a keynote address. To introduce the keynote speaker, I would like to welcome Mr. Rehan Khan, Managing Director, MSD Pharmaceuticals India Private Limited. A very warm welcome and over to you, sir.
Thank you very much. Can you hear me? Am I clear?
Yes, sir.
Thank you. I'm going to be introducing Dr. Randeep Guleria. Dr. Guleria doesn't really require an introduction to this audience. He is the Director of All India Institute of Medical Sciences, and he will be speaking about the preparedness to address the current and emerging healthcare challenges in our country. But let me take a second just to talk about Dr. Guleria. Dr. Guleria was the first DM in pulmonary medicine in the country. He's the recipient of many awards and honors, including the Padma Shri in 2015, Dr. P.C. Roy Award for Eminent Medical Persons in 2014, Himachal Gaurav Puraskar in 2011, and more recently, the Times Healthcare Achievers Awards in the Legends category. Dr. Guleria also received the Doctor of the Decade Award by the Indian Medical Association and the National Excellence Award by the T.P. Jhunjhunwala Foundation for 2017 and 2018. Dr. Guleria has delivered more than eight national and international orations. He has over 450 publications, 49 chapters, 50 research grants, and over 300 invited lectures. Dr. Guleria was a personal physician to the Prime Minister of India from 1998 to 2004, and he has served as a personal physician to many national and international leaders. Dr. Guleria is an advisor and consultant to various international and national bodies, including the WHO in Geneva and the IAEA in Vienna. Thank you very much and welcome, Dr. Guleria.
Thank you. So at the onset, let me really thank the organizers for inviting me and asking me to give this keynote address. Can I share my screen? That would be great if I can just show my slides, if the organizers could allow me to share my screen. I've been asked to talk on preparedness to address the current and emerging healthcare challenges in India. I think it's an important issue because we have to develop strategies of how do we move forward. Often this is not going to be the last pandemic, but we have been having multiple outbreaks in the past, and we need to see how we can address that. Before I move forward, would it be can I share my screen or that's not possible? Otherwise, I'll just give my talk if it's all right without a PowerPoint presentation. So what I was going to say is that when we start looking at this pandemic, what we've noticed is that this is a pandemic which has raged now over 2 years and has actually claimed almost 6 million lives, which is a major cause of concern. And at the same time, it has also shown or exposed vulnerabilities which are present in healthcare systems across the world, including in India. And sooner or later, this pandemic will end, but we have to be prepared for future pandemics. And we also need to see how we can improve our healthcare system based on the lessons that we learned from this pandemic. So I think that itself is a very important issue that we need to keep in mind. One thing I can say that we could say with certainty that there is no going back to the pre-pandemic healthcare system. Things have changed dramatically. There have been new learnings, and I think that is something that we will have to consider as we move forward. Now, one thing else that has become very clear, and that is that this pandemic has actually affected every strata as far as society is concerned. Livelihoods have been affected. Human health, of course, has taken a major sort of beating. Governance and security have been challenged. Social and humanitarian needs have increased tremendously. And the economic system has also been disrupted, whether it be sports, tourism, or various other activities. And this is something that we need to keep in mind. Now, coming to the Indian health system, we all are aware that the Indian health system has two broad categories, the public healthcare system and the private healthcare system. The public healthcare system basically has focused on primary healthcare delivery through community level health programs. It's looked at more of sort of a decentralized primary health centers where some states have done much better than others, but there have also been advanced care provided at secondary and tertiary centers. But a large majority of inpatient care has actually come from private healthcare. This also has a skew because it is basically concentrated predominantly in Tier 1 and Tier 2 cities. And as we go to smaller cities and rural India, the private healthcare system is not that well developed as one would have liked it to be. So, some of the challenges which became more apparent during the pandemic were: one was awareness. There was lack of awareness among public on health issues. And this is important because there is a lot of importance as far as preventive health is concerned. Then was as far as access is concerned, and there was, like I mentioned, geographical inequalities in healthcare provisions. Certain states in the south have done much better than states in the north. Uh, Human resources became a big challenge, and of course, affordability. That is, healthcare. The cost of healthcare has become something which is significant, especially when it comes to the private sector, and the fact that many of patients have to actually pay from their own pocket. And this has actually also been something that came out dramatically as far as the pandemic was concerned. Now, if you look at the impact of COVID-19 pandemic on the healthcare system, it actually hampered the healthcare system in many manners. It's not only the fact that it needed a lot of resources, but private hospitals and lab witnessed a sharp decline in revenue due to delayed medical tourism and elective processes. Elective surgeries like knee replacement or other surgeries were not being done or were postponed. And this also led to a sharp decline as far as hospitals' revenues were concerned. Because of the lockdown and because of various factors, the outpatient departments were closed or curtailed for a very long period. And this also had an adverse effect as far as hospitals were concerned. Besides this, there were major effects as far as health delivery was concerned. And I think this is something that we need to even keep in mind as we plan for the future. For example, there was disruption of routine childhood immunization. A lot of childhood immunization programs got disrupted. I remember in the early days of the pandemic when a lot of doctors in the private sector had closed shop and there were pediatricians. There were parents who were actually approaching hospitals that my child's immunization is due, the vaccination is due, or where do I go to get the vaccination done, because of the fact that many areas had really shut down the immunization program. There were also fewer people seeking care for non-COVID emergencies. So people were too scared to come to the hospital, and this also had a negative effect as far as care was concerned. And of course, a lot of funds and infrastructure was shifted for COVID care, and therefore a lot of non-COVID services suffered. And this is something that has been reported by almost all countries globally, that there was a disruption of essential health services. If you look at what happened globally, it has been estimated that because of the pandemic, HIV cases have gone up by 10%, TB cases have gone up by 20%, and even cases of malaria in certain areas have gone up by almost 30%. So this has had an adverse effect even on other diseases, and this could be something that we could call as a collateral damage that has happened. So there is a need for us to really learn from this and prepare for future crises that may happen. Now, what the pandemic has really taught us is that there is actually a need to overhaul our healthcare system, especially when it comes to crisis management, outbreak management. And this could be infectious diseases, this could be natural disasters, where there are mass casualties. It could also be related to bioterrorism. And therefore, there is a need for us to really have an action plan in place when it comes to emerging health challenges. When we talk of this, one question that comes up is why is there an increase in new infectious diseases? I personally feel, and I've been saying this for quite some time, that the last 20 years of this century has seen a lot of outbreaks which have been indirectly a warning to us that a pandemic is due. We've already had a pandemic in 2009, which was the swine flu or H1N1 pandemic. We have outbreak of SARS, MERS, Zika, H5N1, which is known as bird flu, and even had cases of Ebola which traveled outside Africa. This has occurred due to multiple factors. One, of course, is the fact that there is now more travel, trade, and connectivity. Unlike what was there 20, 30 years ago, that humans lived in small bands, or people stayed in their country or in their district or state and didn't really travel out that much. Now there's a huge amount of air travel, and therefore, with travel, infections do tend to spread from one part of the world to the other. So there is travel from the old to the new worlds, and infection also tends to travel with that. There's also the issue of growing urbanization, where we see a lot of effect that this has with crowding in cities, and this affects sanitation. This leads to mosquito breeding, and diseases like dengue, Zika, chikungunya are on the rise because of issues of sanitization, because of overcrowding, which we see as part of urbanization. Also, the infections that I mentioned right now, all of them have a zoonotic origin. H1N1 came from was known as swine flu. We have bird flu. We have even Zika, which is has origin which is basically either in birds or in animals, and that is true for MERS coronavirus and even for the COVID-19. So it's important for us to to understand that viruses are jumping species and becoming now more compatible for with human to human spread, and this is because of the overcrowding, urbanization, and like I said, travel that is happening. And it's important for us, therefore, when we talk of the future and look at emerging healthcare challenges, that to look at it in a holistic manner as one health. And one health is basically human health and animal health, which are interdependent as well as being linked to the healthcare of the ecosystem. And that is something that we need to keep in mind. That when we talk of health, we should look at human health, animal health, the health of our environment, and then try and develop strategies which are more holistic. And this is something which has been seen globally also. Now, what are the potential avenues and what can we do for the future? I think few things that we need to look at. One is increase public health awareness. We need to also see how we can upgrade manpower and medical infrastructure in tier 2 and tier 3 cities. Health insurance schemes and awareness needs to be given a push. We have to start using more and more of technology which can help us to reach out to our patients. And one thing that came out during the pandemic was telemedicine. We need to develop policies for pandemic preparedness and also have strategies where we can have vaccines and drugs available early rather than late. Now, even now, there is a lack of public health awareness, and therefore, there is a need to develop strategies which can improve preventive health. And this has been shown to be useful when it comes to reproductive health, nutritional practices, child health, and even environmental health. And I think this is something that we need to focus on a lot. Like I said, we need to upgrade manpower and medical infrastructure in tier 2 and tier 3 cities. This is something which the government is now doing. There's increasing number of hospital beds per thousand population. There's also more government medical colleges being started in unserved areas. Government has also started building medical colleges in various districts, and hospital chain and specialty centers are coming forward to build more capacity, especially in tier 2 and tier 3 cities. And this is some of the learnings that I think there has been during the pandemic, that we have a lot of health infrastructure available in tier 1 cities, but as we go down, that is not something that is easily available. The other issue is developing a robust health insurance scheme and awareness. This has become more and more popular, but still there is a long way to go in terms of being able to provide some degree of health insurance to our population, because even now the cost of treatment is expensive and many patients have to pay out of their pocket, and this leads to problem. And we already have the Ayushman Bharat by the government of India, but we need to look at other schemes which are more inclusive and covers a wider population. Then we need to start seeing how we can use technology much more. In my mind, we haven't used technology as much as we should as far as the health sector is concerned. The government had adopted the use of technology in the form of Arogya Setu. The CoWIN platform itself is a huge technological advancement which has helped the vaccine rollout and been very successful. But I think we need to really see how we can take it forward. Telemedicine is another area where technology had been very useful, both for the management of COVID patients, but even for non-COVID care as far as care was concerned during the lockdown and during such time. And I personally feel that this telemedicine will remain now an important tool where we could reach out to patients in rural India and other parts and provide care. You could also use this technology to provide care in terms of ICUs. We have a whole concept of e-ICUs, where you can manage patients or help the doctor to manage patients in a smaller center by really guiding him using technology now to manage patients in a critical care setting. So this is something that we need to develop and move forward. And these are the challenges that we will need to sort of look at as to how do we roll it out so that it becomes more and more user friendly. The government had released the telemedicine guidelines in March 2020. It is a work in progress because we still need to see how we can make it more robust, both in terms of safety and in terms of it not being misused. The ministry had introduced the e-Sanjeevani app, which is an integrated web-based telemedicine solution. So that is also active and helps patients in getting solutions for their problems. As we move ahead, I think the challenges that we have is surveillance systems, laboratories with biosafety facilities, training of public health officials and existing public health framework, and research capacity to quickly develop medicines and vaccines. Surveillance, I think, is very important because whenever we have an outbreak, the rapid detection of any unusual pattern of disease is paramount. If we find a cluster of unusual cases, there has to be an activity that there is information transmitted, there is some response that happens, and quick containment can happen so that the infection doesn't spread to other areas. We've seen that in the south, we had an outbreak of Nipah virus, which was controlled very efficiently. But this type of surveillance system needs to be active for the future for any outbreak so that we don't let it to become an epidemic or a pandemic. There is a global platform, the Global Early Warning System, which is being run jointly by the Food and Agriculture Organization, the WHO, and the World Organization for Animal Health. It needs to become more active so that it is able to globally monitor any outbreak which is happening and be able to take action, but it needs to have that support as far as policymakers are concerned. There's also in my mind a need to push for applied research where we can look at developing broad spectrum therapeutics against zoonotic pathogens with potential of emergence in humans. And that is something that we need to do. Why do we need to do that? The pandemic showed to us that there is a need to anticipate and prepare rather than to merely react. An example is that antibody therapeutics for COVID-19 were not approved till November 2020. And in contrast, we used a drug which was already there. We repurposed it, remdesivir, for the treatment of COVID-19 as early as May 2020. Although this drug was not meant for COVID, it was predominantly being evaluated for Ebola. So therefore, we have to have a proactive strategy rather than a reactive strategy as far as drug development is concerned. And this has been very aptly shown that if you have a proactive strategy, you can roll out the drug much faster than if you have a reactive strategy. Drugs that we can have can be repurposed drugs, which can be used, and you can have a library of drugs which can look at what are the drugs available. Remdesivir is one example. Or you can develop novel drugs which can actually start being developed against a particular pathogen. A classical example is the monoclonal antibodies that were used in COVID-19. But I think to do that, we have to have synergy between three solid pillars. One is the academic institutes, where the academic research is done. They are the ones who would be able to come out with the molecule. Then there has to be industry support in development, funding, and manufacturing of the molecule. And then there has to be support from the government also in terms of funding and regulatory guidance. So unless all three move in synergy, it will not be possible to develop a drug or a molecule at pandemic speed. And I think it's also important for us to understand that we need to look at highly effective or drugs which are sort of effective against a family or a group specific therapeutics and vaccines rather than against a particular virus itself, because that can take a longer time. So it's important that we are able to develop broad spectrum antivirals like we do for antibiotics, which may be more useful. And many drugs can be looked at, those which have a direct antiviral action or which are directed against the host. And we did develop such drugs during COVID-19, but I think we need to have a platform ready as we move forward. The challenges that we have as far as drug development is concerned is that we are looking at an unknown pathogen. We don't know which virus will become a human virus and cause a pandemic. There are no sort of models for in vitro or in vivo screening. In vivo screening, the market potential is unknown, and of course, there is a whole issue of the the resources that we have, prioritizing the resources that we have as far as pandemic is concerned. So I think these are the challenges, but we were able to overcome these challenges to some extent as far as vaccine development was concerned. We one thing that the world was able to do and India was able to do was come out with a vaccine at pandemic speed by doing things in parallel rather than in sequence. And I think this has also been one of the great learnings that we've had, that we can actually, if we really put our minds together, do things in a manner that we can have a vaccine in less than a year if we are willing to have the commitment in terms of the financial resources and the commitment in terms of the regulatory approvals being done quickly. This is something that we need to really look at. And I think these are the learnings that we've had as far as the future is concerned. The government itself has, of course, given the COVID-19 emergency response and healthcare system package, which is on more than 23,000 crores for developing a lot of these strategies. So I'd just like to say that the pandemic has exposed the shortcomings in the healthcare system worldwide. It has also shown that the pre-pandemic health system were unequal, costly, and not prepared to tackle a pandemic of the magnitude of COVID-19. We need to brainstorm on health policies beyond COVID-19, and a significant change is required to deliver effective and affordable healthcare to all. And I think expansion of medical facilities to underserved areas, increased coverage of public and private healthcare insurance, and active health planning for future pandemics are the key priorities that I think we need to focus on as far as we move forward. So I'll stop here, and I would be happy to take any questions. Thank you very much.